Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
This session is the third of a three-part series that reviews the effect of viral infections such as influenza, COVID-19, and the common cold, and their vaccines on heart health. Anything else you'd like me to say about introducing you, Dr. Tomar?
At any time, if any of you have any questions or you can't hear me or you need to slow down, just let me know. We have plenty of time to cover tonight's lecture. Thank you for that introduction. So we'll basically talk about the 4 respiratory vectors and how they can affect heart health, and which vaccines and treatments are recommended for all these vectors. So my goal is to kind of demonstrate how these viruses that in the common discourse don't seem to have much risk to heart tissue, but they actually do pose a large risk in elevating heart attack risk and also heart failure risk. And so hopefully to encourage all of you to seek vaccination for these vectors. So we're going to cover influenza, COVID-19, and respiratory syncytial virus, or RSV, and also pneumococcus, which is a bacterium that is the general cause of bacterial pneumonia. And so I want to first start by talking about kind of a shared pathology of all these 4 diseases that basically set the stage for clotting events. And blood clotting is is necessary because as a clot occurs in the coronary artery, that then causes the death of heart tissue because blood can't get to the heart myocardium or muscle tissue. And so that's the definition of a heart attack. So all 4 of these vectors share this same disease pathway. All right, so first, the combination of factors that these vectors release, and also the inflammatory components that the white blood cells release, can stimulate the clotting cascade. So there's a set of very complicated biochemical steps that allow platelets to clump and cause clots. Severe infection can actually cause that can trigger the clotting cascade. Also, during severe infection, there are changes in the inner lining of the artery called the endothelium. It makes it more likely for substances to pass through it. The problem with that is that inner layer becomes weaker. And so if there's a plaque that already pre-exists, it can rupture off and it block flow downstream, causing a heart attack. We talked just a few moments ago about how there's more permeability. That just means that the endothelium becomes easier for things to pass through it. And the reason for that is that the body has to get white blood cells to the infection. And if the inner lining of the artery is completely impermeable, the white blood cells can't get anywhere. So the body has a very smart mechanism that allows these cells to kind of become like a sieve, and white blood cells can get through the endothelium and start attacking the infection. The problem with that is that not only do white blood cells get through, but also all of the plasma. So the plasma is basically all the components of the blood minus the cells. That's the white blood cells, red blood cells, and platelets. And so as that plasma gets out of the arteries and veins and leaks into what's called the third space, which is connective tissue or in the airspace in the lungs, blood pressure starts dropping precipitously. And so the reason that's very important is that when blood pressure drops, there's really poor circulation, and when blood pools, that actually stimulates blood clotting, which can be very dangerous, and again can set the stage for a heart attack. And then the next factor, we can break it up into the amount of oxygen that's available. So in general, in advanced infection, there's a lot less oxygen available. And the reason for that is that due to this permeability of the endothelium, a lot of fluid seeps into the air spaces in the lungs. And so there's very little surface area for gas exchange. So the body can't ventilate out waste products like carbon dioxide, and it can't then absorb oxygen to meet metabolic demands. And so that's one mechanism that drops the supply of oxygen. And also, this drop in blood pressure doesn't only affect your limbs, your brain. It can also drop the amount of blood going into the actual coronaries. So as blood pressure drops in the coronaries, the heart tissue is not getting fed with oxygen adequately, and that lack of oxygenation in the heart tissue is very harmful for heart muscle, and it can cause heart attacks or damage that can lead to chronic heart failure if it occurs for a long enough time. Then on the flip side, there's also a great deal of demand for oxygen. So we already have a situation where there's less oxygen supplied, and now we have an infection that requires a lot of oxygen. So basically different parts of the body are fighting for very little oxygen. And the end result of that is that the heart tries to compensate by pumping as fast as it can and with the greatest force it can. And while it can do that for a couple minutes, it can't do that for a protracted period of time. And so over time, the heart muscle gets damaged. And you think of it as like a burnout of the muscle tissue where physically it gets damaged. And that sets the stage for heart attacks or heart failure. So just to review, so these agents can trigger clotting with cascade. They can rupture plaque, which can then cause a heart attack. The permeability of the endothelium can cause a big drop in blood pressure, which is mentioned before. It can set the stage for clotting, which can then result in heart attacks. And then there's less oxygen, and so with less oxygen, the heart tissue is not fed appropriately and can get damaged. And then in order to compensate for that low oxygenation, the heart basically burns itself out trying to keep up. So we'll switch gears and now talk about individual vectors. So we'll start with influenza. So several studies have demonstrated that patients who have influenza and who have been vaccinated have much lower risk of developing acute heart disease, heart attack, or heart failure, congestive heart failure exacerbation. And this is even more so in patients who have known heart disease. So it's actually very important to get vaccinated in order to avoid having a severe illness that could then lead to a severe infection that could then trigger a heart attack. And so there are several ways to reduce this risk, and we've been through 2 years already of contact precautions by hygiene, masking, social distancing. Those are still very effective especially during influenza season, than getting vaccinated. And sometimes, despite vaccination, you can still develop an infection. And so getting typed is very beneficial because you can benefit from getting Tamiflu, which is an antiviral that is effective for both types A and B influenza. And it's a good idea to get typed as soon as possible because it's effective only within the first 48 hours of infection. And so a clue that could encourage you to seek follow-up with your general doctor to get Tamiflu would be if the first sign of your infection is a very high fever. That generally is associated with influenza. If you're associated with many other causes of infections, but that could be a clue that you can get swab for influenza in order to get the Tamiflu, which can then reduce the severity of infection. So we'll talk about COVID-19. So our the distinguishing hallmark of COVID-19 is that it is very effective at irritating tissues throughout the heart. It can irritate brain tissue, the surrounding tissue, the brain couple of inches. It can irritate heart tissue, the pericardium, which is the sac that surrounds the heart. Obviously, the lungs can irritate the peripheral nervous system. But in our case, we're focusing more on the effect on the heart. So I picked out ARDS, or acute respiratory distress syndrome, because COVID-19 results in a very severe inflammation of lung tissue. And one of the end results of ARDS is that it can promote clotting within the lungs called the pulmonary embolus. So, and you can imagine if there's a clot in the lung and the heart is trying to pump blood through the lungs and then out back to the heart to perfuse the rest of the body, that just won't happen. And so the right lung or the heart is trying to pump against this blockage, and the right heart ends up undergoing heart failure. And so that's one mechanism that COVID-19 harms the heart. Another is that this widespread irritation of either the pericardium, that's that sac around the heart, or the actual heart tissue, can cause an irregular heart rate. Looks like there's some feedback. I'm sorry. Can you hear me, Deb?
Yes.
Yes.
Yeah, I just heard some feedback. So basically, just to pick up where I left off, there's inflammation in the heart that can then lead to an irregular heart rate called an arrhythmia. And there are many types, but the three that are most commonly associated with COVID-19 is atrial fibrillation. That's where the heart is just contracting in a completely uncoordinated manner. And so the end result is that the amount of blood getting pumped is very low. And as we talked about earlier, when there's little blood going out, that means the blood pressure drops, and your blood pressure drops, blood pools, and that sets the stage for clotting. And this could lead to deep vein thrombosis in the arms or legs, pulmonary embolus to lungs. It could lead to a stroke in the brain, or a heart attack if a clot passes into the clot areas, or there's pooling of blood in the coronary arteries. Another arrhythmia, whether the symptom of an arrhythmia is called postural orthostatic tachycardia syndrome. So I know that's a mouthful, but all that means is that there's a mechanism that allows us to regulate blood pressure when we stand up. So generally when we stand up, blood tends to pool in our legs, but our nervous system is able to squeeze or make the arterial walls squeeze to get blood pressure back up to the heart and brain. But in POTS, that mechanism is perturbed because of this wide-ranging inflammation from COVID. So what ends up happening, these patients stay up, blood pools, they get lightheaded, they pass out, and this can actually last for weeks, months after the resolution of the COVID infection. And in very rare cases, arrhythmias can lead to fatal ventricular tachycardia, which requires urgent attention. So we'll talk now about ways to reduce risk. We've all been through this in nausea over the past couple of years, but again, it's worthwhile to emphasize the need to practice hand hygiene, masking, social distancing, especially now that we're heading into cold season. And also to make sure that you get your annual vaccines and your boosters as required by or suggested by the CDC. So the idea of vaccination for both COVID-19 and influenza is simply to reduce the likelihood of severe illness. So you could still get an infection despite being vaccinated, but it's very prudent to get vaccinated in order to avoid the risk of those severe infections that can then cause heart attacks. So if you suspect COVID-19, it's very important for you to get swabbed, and a good way to suspect it is if you lose your ability to taste or smell, and that's also accompanied by severe body aches. And so the utility of getting screening is to take an antiviral called Paxlovid. And so unlike the previous antiviral, you have a little more time to initiate this medication, roughly 5 days from the start of your infection. And this is similar to the vaccine. The idea of Paxlovid is to stop the progression of the infection before it gets severe and lands you in the hospital. It requires mechanical ventilation. So for sure, if you have COVID-19 and you're above the age of 65, definitely pick up the Paxlovid, as well as anyone above the age of 65 who's ever been vaccinated. And also, I think this is more of more rare cases, so people who have an immune compromised state, that's things like HIV, hepatitis C, a lack of a spleen, and other more rare syndromes that affect the immune response. And then finally, patients in general, regardless of age, who have multiple comorbidities, who basically just don't have adequate reserves to fight off infection, they should do everything possible to avoid or to mitigate the risk of severe infection with Paxlovid. And so we'll move on to the less known infection that generally is associated with pediatric populations called respiratory syncytial virus, RSV. And so this condition has attracted more attention because we've developed new technologies that has made vaccination for RSV more widespread. So the reason that our RSV is important for patients above the age of 65 is that generally RSV comes in conjunction with a co-infection during the pneumonia. So commonly you might have bacterial pneumonia with RSV on top of it. So the RSV can amplify another infection, which can drastically increase the risk of lung damage and also heart damage, as we talked about previously. So there are several things that you can do to reduce your risk. So, like I said, RSV is mostly associated with pediatric populations. So I think above the age of 65, it's a good idea to avoid ill children with upper respiratory infections. because generally almost 80% of those infections are due to RSV, especially in babies. And then obviously the same precautions as we talked about earlier. And then, so I talked about some unique symptoms of COVID and influenza, but RSV doesn't have any distinguishing features. And so we don't have widespread use of screening labs. Generally, screening for RSV is done in the hospital when the doctor has to figure out exactly the cause of bacterial pneumonia in order to be totally certain the treatment will be effective. So you don't need to see your physician to get typed because currently we don't have an antiviral for RSV. However, you can benefit from vaccination. And so anyone above the age 60 or pregnant women can benefit from Ambrisvo and Risvia. And then those each age of 50 and 59 also have other severe comorbidities like COPD, heart disease, chronic kidney disease. They could benefit from another vaccine called Arexvy, which is the only FDA-approved vaccine for that particular group. And all these are provided by your health plans. So don't think that you'll get a surprise charge. But I think that now that these vaccines are more widely available, I think that they should be, the RSV vaccine should be just a part of the regular vaccination protocol of the year. So now we'll wrap up with pneumococcus. So pneumococcus is actually a bacterium. So the previous three vectors we talked about were viruses. This is actually a bacterium. And so it is the leading cause of bacterial pneumonia. There are many causes of bacterial pneumonia, but pneumococcus is especially prevalent above the age of 65. And it quite often it can lead to very severe damage of the lungs because the bacterium can cause cavitations, or you can think about it. It penetrates through lung tissue, and the body will try to wall it off, and you could have like kind of a chronic infection that sometimes even needs surgical removal. And so since it can cause severe lung infection, therefore it can trigger or precipitate acute heart disease and heart attacks. So much like the other cases, just to practice good hand hygiene, masking, social distancing, can drastically reduce the risk of pneumococcal pneumonia. And also, there is no specific screening for pneumococcus, at least in the outpatient setting. That's, again, done more in the hospital setting to know exactly which microbe is causing the infection in order to treat properly. However, if you develop kind of unique symptoms of pneumococcal pneumonia, which is this pain with deep inspiration, and also if you have like a slightly bloody colored sputum, I would strongly suggest that you follow up with the doctor because you'll need a chest X-ray. So if you have these common symptoms and you have a positive chest X-ray, that will be enough for your doctor to treat what's called empirically. That means that he or she doesn't have 100% lab evidence that you have pneumococcal a vaccine, but based on the evidence, you likely would benefit from antibiotics at pneumococcus. However, if that antibiotic doesn't work, generally the next step is either admission or a trial of another antibiotic. But either way, if you do have pain with inspiration and respiratory sputum, follow up with your doctor to get a chest X-ray. And so, and that in general, to mitigate your risk, anyone above the age of 65 should be vaccinated at least once with the polydenolate pneumococcal vaccine, and then those between the age of 19 and 64 with specific comorbidities that your doctor will tell you about if they apply to you. Those patients should also have a vaccination. And then compromised patients on anti-rejection medications, HIV, hepatitis those type conditions. And then also those with a cochlear implant. Those patients have a higher risk of developing pneumococcal infections. So just to review, we covered 3 viruses and 1 bacterium, all which can elevate the risk of acute heart events in severe infections. So that'll bring to the end of the presentation. But do any of you have any questions or do you need any clarifications? Any questions?
Come on now. Talk about it.
I'm sorry, did you get that?
I was just saying, come on now, let's talk about it.
Yeah, sure.
I have a well, I don't know if it's a question. I just would like to thank you for your presentation today. Oh, this is Joyce Brown. You probably see G Hunt. I don't know, my Zoom is not doing right, but anyway, I didn't know all of the effects that these different viruses and bacteriums have on the heart, and I am just so happy that you took the time out to give us this information. And with COVID coming back, I mean, they never left, but coming back with a little vengeance, slowly but surely, and RSV and that new pneumonia, pneumococcus, I can see it right. But I have seen some people, and sometimes I feel like I don't see a lot of people with their mask on or anything like that, but I have my eyes on it. I feel like I'm like, oh, okay, Joyce, you didn't get the memo, but I got the memo, and I am afraid to walk out there among a whole lot of different people that I don't know, that especially the RSV one, when you notice that little kids, especially they're going back to school now, and then some of them, and it ain't just them with it, it's the see, I'm over 65, so I really, really, really have to watch myself, and I know I'm dealing with the high blood pressure thing too, so I really have to be on point. And I'm so glad that you came and spoke to us so that I can be aware that I might not be the fashion statement with my mask on and trying to wash my hands. And I'm going back to where we started back in the day with this COVID-19, because I know that it can slip through the cracks when you least expect it, because the person that you see might not look sick, and they could be carrying their infection. So be so careful out there and be aware, especially if you're dealing with any type of heart disease or high blood pressure, or diabetes, or any chronic disease, to be careful, because I'm on the watch, and I'm glad you brought this to my attention, and I'm going to stay on top of it. And I really appreciate your presentation today. Let me get off the soapbox now. Thank you.
And I kind of like what I just wanted to impart to all of you is just encourage you to get vaccinated, and just keep things simple. I mean, sometimes masking can be a little cumbersome, but kind of my rule of thumb is that when I'm in clinic, I just don't touch my head, and as long as I just don't touch my head, I mean, I avoid maybe let's say 85% risk, and I'm the other it's just that I sometimes wear masks if there's someone sick around me, but otherwise I also can't. It's a little too much to wear masks all day. But as long as you're vaccinated, and you're just not kind of rubbing your eyes, just touching your nose, your mouth, you'll be all right. But the big protective profile will be in the vaccination. So hopefully this will kind of shed a little more light that these severe infections, they can really precipitate heart disease, and I wouldn't want any of you to be in that situation.
How many vaccines have there been? Because I got the first one, and then I got a booster for that. And should I get another?
So, right. So I'm sure that your physician has a listing of all of the dates and the type of booster that you got. So as long as you can just give them a call and tell them if you're due for anything, because it's possible that maybe you accidentally did take one booster, but as long as you get them the latest one, that'll allow you to catch up. So the easiest thing would be like every 6 months, you could just give your doctor a call, and the nurse will tell you if you're up to date with your COVID vaccination. But generally, there's we're going to start. I think the pattern that's emerging is that we'll get a booster every 6 months, and this will be who knows for how long. But I think it's worthwhile just to again avoid really severe illness, because I mean, COVID still is. I mean, every day people are still expiring from COVID. That's gone away.
All right, thank you. Let's go ahead.
Yes, I currently I work with Tennessee SEAL with Missouri College out of Nashville. We were told that there is a new COVID-19 vaccine out, and that I think Walgreens had it first, and it's probably in your doctor's office. If not, you might want to ask about it, because it's a brand new vaccine for COVID-19, the newest one. So that was to answer one of her questions.
Thank you.
I just have a quick question with the pneumococcal vaccine. I heard that if you took the Prevnar 20, you only take that one time in your life.
Oh yeah, thank you for making that distinction. That's very important. So the influenza and COVID-19 vaccines, those are annual for sure. The RSV and the pneumococcal, those are basically just once in a lifetime. There are a few cases where patients need a booster, but in very, very rare cases. So as long as you get your pneumococcal once at the age of 64, that's sufficient. And so the PSV or PCV20 is that sufficient for that.
Could you state that again, doctor, please? I'm trying to write it down.
Oh, sure. So the influenza and the COVID-19 vaccines are annual, but the RSV and the pneumococcal vaccine, also called the PCV20, both of those are just once in a lifetime, except in very rare conditions where we might need a booster. So as long as you are above for RSV above the age of 60, just need it once. And in the case of pneumococcal or the pneumococcus, you just need a PCV20 once above the age of 64.
Thank you. Thank you so much.
So I've got a question, Vanessa Coburn. If I took the original COVID-19 and the booster, like someone mentioned before, and since then I haven't taken it, which would mean that I might have missed at least 2 additional ones. So when I go to the doctor to get a COVID-19, am I going to have to take 2, 3, or 4, however many I missed, or just the...
Oh, no. So you can think of the vaccines that are developed or will be developed roughly every 6 months. They're aimed at the most prevalent subtype of COVID-19 that's out there. So whatever you miss, generally those strains have already kind of died out, and they're focusing on the virus strains that are around today and over the next 6 months. So if you missed the previous boosters, don't worry about that. Just get the latest one, and you'll have like a real-time protection for the next 6 to 9 months.
Okay, thank you.
Thank you so much, Dr. Tamar. And it was very informative. And so, peace out.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.